Hi friends, good evening. Once again welcome back to my channel Mookambika Nursing. Friends, here we are discussing questions for RRB Nursing Superintendent exam. Also these questions will helpful for your other nursing officer exam. If you are watching my channel first time, kindly go through my previous videos. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle. Today's first question. The nurse is assessing a client hospitalized with a duodenal ulcer. Which finding should be reported to the doctor immediately? Options. Option A, BP 82/60, pulse 120. Option B, pulse 68, respiration 24. Option C, BP 110/88, pulse 56. Option D, pulse 82, respiration 16. Here the question is, a nurse is assessing a client with duodenal ulcer. The diagnosis of the patient is duodenal ulcer. Okay, so among this option, which finding, if she noted, she should immediately report it to the doctor. Okay, so what is duodenal ulcer means? Duodenal ulcer is a break in the mucosa of the duodenum. Risk factors and causes include infection with H. pylori or Helicobacter pylori. Also alcohol intake, smoking, stress, caffeine and the use of aspirin, corticosteroid and NSAIDs are the risk factors for the development of this duodenal ulcer. If the patient is having duodenal ulcer, we can see decreased blood pressure and increased pulse rate. Okay, this is mainly associated with bleeding and shock. Duodenal ulcer may cause bleeding. Okay, so pulse rate will be increased and blood pressure will be decreased. So that we can see in option A. That is BP is 82/60. It is low BP and pulse rate is above 100. Okay, it is 120 is there. So tachycardia we can see here. And the remaining option all are within normal limit. Okay, option B, option C, option D all are in normal limit. So the correct answer is option A. Move on to the next question. The nurse is instructing the client to perform a testicular self-examination. The nurse tells the client. Options. Option A, to examine the testicles while lying down. Option B, the best time for the examination is after a shower. Option C, to gently feel the testicles with one finger to feel for growth. Option D, the testicular examination should be done at least every 6 months. Here in this question, a nurse instructs the client to do self-testicular examination after a shower. Okay, so the correct answer is option B. The best time for the examination is after a shower. And the next question is, the client with cancer is receiving chemotherapy and develops thrombocytopenia. The nurse identifies which intervention as the highest priority in the nursing plan of care. Options. Option A, ambulation 3 times a day. Option B, monitoring temperature. Option C, monitoring the platelet count. Option D, monitoring the pathological factors. Here the question is, a client with cancer is getting chemotherapy and immediately patient develop thrombocytopenia. Thrombocytopenia means decreased platelet count. And our question is, which is the highest priority nursing care? Okay, so what the nurse should focus mainly for this thrombocytopenia patient? What she should do is, she should monitor the platelet count. Okay, because if the thrombocytopenia or decreased platelet count means there is a tendency to bleed. So the nurse should monitor the platelet count. And the next question is, normal pH of blood is? Options. Option A, 7.15 to 7.35. Option B, 7.35 to 7.45. Option C, 7.35 to 7.65. Option D, 8 to 8.5. Normal pH of blood. pH of the blood was discovered by Dr. Swaranson in 1909. Okay, 1909. And the pH less than 7.35 is acidic and the pH greater than 7.45 is basic. And the normal pH of blood is 7.35 to 7.45. And the correct answer is option B. And the next question is, which person is at greatest risk for developing Lyme disease? Options. Option A, computer programmer. Option B, elementary teacher. Option C, veterinarian. Option D, landscaper. Here, who is at risk for developing Lyme disease? Lyme disease is mainly transmitted by ticks, which is found on the deer and mice in wounded areas. So it is transmitted by ticks. So the persons who are in landscaper are the highest or greatest risk for the development of this Lyme's disease. Option D is the correct answer. Move on to the next question. The sputum of a client remains positive for the tubercle bacilli even though the client has been taking isoniazid in combination with other antitubercular. The nurse recognized that the client taking isoniazid should have a negative sputum culture within. Options: Option A 2 weeks, Option B 6 weeks, Option C 2 months, Option D 3 months. Here the question is, a patient is taking isoniazid in combination with other antitubercular drug. Okay, and the sputum of the patient is positive after taking this isoniazid. Isoniazid is an first line antitubercular drug. Here the question is, the nurse is thinking that after giving this isoniazid, how long it will take to get a negative sputum report, or it will take a negative sputum culture, and the negative report will get within 3 months. Okay, after giving isoniazid, within 3 months the sputum culture will be negative. Okay, if the patient is taking other antitubercular drug or combination with other drug, means maybe it will take long time, but usually after giving isoniazid, within 3 months the sputum will be negative. Move on to the next question. Hartmann solution include all the following except. Options: Option A sodium chloride, Option B sodium lactate, Option C calcium chloride, Option D calcium lactate. Hartmann solution is also known as Ringer lactate. Okay, here we can see Ringer lactate is also known as Hartmann solution. Its compositions include sodium chloride, sodium lactate, potassium chloride and calcium chloride. Calcium lactate is not in Ringer lactate solution. So that is the correct answer, option D, calcium lactate. Move on to the next question. Milky white color of urine is due to the presence of. Options: Option A dyes, Option B pus, Option C multivitamin, Option D old RBCs. Our question, milky white color of urine. Here we can see the color of urine and why it is like that. Okay, so black color of urine is due to the presence of old RBCs. Okay, black color, and bright yellow color is due to the presence of multivitamins. And milky white color, that is our question, it is due to the presence of pus in the urine, that is known as pyuria. Okay, and pink to red color is due to hematuria, and blue color of the urine is due to the presence of dyes. Dyes means due to some diagnostic procedure dyes are injecting to the patient body, that may excreted in the color of blue. Okay, orange color is due to concentrated urine or maybe due to jaundice, and pale yellow color due to dilute urine. Okay, in our question, milky white color of urine is due to the presence of pus, that is known as pyuria. So the correct answer is option B. And the next question is, what is the most important goal of nursing care for a client who is in shock? Options: Option A manage fluid overload, Option B manage increased cardiac output, Option C manage inadequate tissue perfusion, Option D manage vasoconstriction of vascular beds. Our question is, the main aim or the main goal of nursing care for a client who is in shock. Here we can see nursing management are focused on correcting and maintaining adequate tissue perfusion, because inadequate tissue perfusion may be caused by hemorrhage, as in hypovolemic shock. Okay, so the nursing management is mainly focused on to maintain adequate tissue perfusion. Okay, so the correct answer will come option C, manage inadequate tissue perfusion. Move on to the next question. Which finding indicate hypovolemic shock in an adult who has had an 50% blood loss? Options: Option A pulse rate less than 60 beats per minute, Option B respiratory rate 4 breaths per minute, Option C pupils unequally dilated, Option D, systolic blood pressure less than 90 mm of Hg. Hypovolemic shock is one of the emergency condition in which there is severe blood loss from the body or other body fluids are losing from the body. The signs and symptoms we can see. Signs and symptoms of hypovolemic shock include systolic blood pressure less than 90 mm of Hg and narrowing pulse pressure, then tachycardia. Tachycardia means increase heart rate. Okay, and tachypnea. Tachypnea means a rapid or increase respiratory rate, and cool and clammy skin, decrease urine output, and mental status changes such as irritability or anxiety are the signs and symptoms of hypovolemic shock. In our option D is the correct answer. Systolic blood pressure less than 90 mm of Hg. BP will be low because of loss of fluid from the body. Here only 50% blood loss, then also BP will be low, and pulse rate will be high, respiratory rate will be high, so that will not come correct answer. Option D is the correct answer. Friends, here we are discussing questions for RRB Nursing Superintendent exam, also DME Kerala PSC Staff Nurse exam. If these questions are helpful for your exam preparation, please share my videos to your friend circle.